Well, here's a really startling statistic to consider. Did you know in our country this year, 37,000 Americans are going to be diagnosed with oral cancer? It's way more common than you think, and we're going to learn more about it because this is April, and this is actually Oral Cancer Awareness Month. The expert on all this is Cris Duval. She is a dental hygienist with advanced cosmetic and laser dentistry. It's really great to see you, Cris.
Good morning, Penny.
I'm looking forward to learning more because I had no idea how common oral cancer is.
Yes, one person dies every hour of every day. It kills more people nationwide than melanoma and cervical cancer combined.
Wow.
So what your viewers need to know is they need to get an oral cancer screening at least once a year.
All right, and the place to go to is your dentist's office,
Absolutely.
right?
We're the first line of defense, and we're the ones that should be doing it at every visit, every time. So if that's not happening, you need to request it.
All right, so you're going to show us what's all involved in an oral
Absolutely.
cancer screening,
Yes.
right? And this is Kathy,
Yes.
our lovely model, or guinea pig, or whatever we want to call her. She's got pretty teeth, too.
So we do kind of two phases. We do an extraoral exam and an intraoral exam, and this is going to be abbreviated because we're working with TV here today,
Right.
and time limitations. So we check around on the outside of the head, make sure there's not a lump and a bump on one side that's not on the other, and then we also check down the near the throat for any hard masses or anything that could be there, and then we take a look in the mouth.
Okay. Seems fairly straightforward so far. Nothing
Absolutely.
too painful?
No.
Little facial palpitations?
Yes.
Okay.
A little massage. Stick your tongue out at me, Kathy. Good. So we're going to look on both sides of her tongue, underneath her tongue. Put your tongue up there. Good. Now we're going to also look down her throat. Give me a big awe and hold it for a minute. We have a new player in oral cancer, and oral cancer is on the rise. It's now considered an epidemic. And that's the HPV virus that causes cervical cancer, also causes oral cancer.
Wow, and it's so common, HPV.
Absolutely, and that's what we are really trying to impact is this nation's awareness about oral cancer. When you look at oral cancer, or at cancer statistics, oral cancer isn't even listed on there. It's the forgotten disease.
Wow.
And it's very easy to look for. It's right out there for it. It's not like we have to scan some part of your body.
Right, you have another diagnostic tool though that you use
Absolutely.
beyond your external and internal exam.
This is called the Velscope, and it uses a blue light. It's very advanced technology. It helps me look past what I can see with my own eyes. It's a very critical part of your oral cancer screening.
All right, so it's so far painless, right? Yeah, so there's no more excuses about not to come in and get an oral cancer screening. So once a year you need to come in, and how can people get more information?
Well, this month we're doing thousands of oral cancer screenings across the country. You can go to our website, www.acld.com, and there will be a link there to the Oral Cancer Foundation, and there are tons of screenings going on this month, and you can find out where the screenings are. There's walks, there's educational events, and it's all about becoming more aware and getting your oral cancer screening. And then tell the people you love and care about, ask them if their hygienist did it as well, so it can make a difference.